Okay, now we're in part two of our lesson about the skeletal system of the body. So, your skeleton, your bones, are connected with joints, and there's several kinds of joints. There's a ball and socket joint in your hip and your shoulder that connects your arms and legs. So that here's the ball of the um, think the leg bone, and then you have a socket that the ball fits into, and it rotates like this, so that your leg and arm can move in almost any direction. Like so, there you have the hinge joint. These are joints like they work like a hinge. Think about your elbow and how it extends in only really one direction. You can't bend it, but so far, and it bends like a hinge of a door. And your knee does the same thing. Your fingers, the end of your fingers, the last two joints are also hinge joints. Okay, so we have that. Then there's a pivot joint. These are located with things that you can move, like your neck can pivot in different directions. And So you think about that. It says neck, wrist, and ankles are pivot joints. Then you have some joints that are not movable, really. There's different plates or whatever, different bones that make up your skull. And these bones are when you're baby, like just born, they do move a little bit, but then they harden and place, and so they don't move once you're not a baby anymore. You have some gliding joints, which are your wrist joints. You have some very bones that are like blocks, but they slide back and forth. Those are gliding joints in your knuckles. Okay, move on. The connectors of your body. Oh, okay. So how are your bones connected together and stay together? So you have what's called a ligament, and this is connective tissue. The connective tissue connects bone to bone. So this is your knee. That's your kneecap, otherwise known as a patella. Then there's a connective tissue that goes from your lower leg up to your upper leg bones that connects those bones together. You see there's another connective tissue here. These is called a ligament. A ligament goes from bone to bone. Then you have a tendon, which is connective tissue here. And these connective tissues connect the bone to the muscle. So when the muscle contracts, we're going to talk about that in our muscle lesson. The muscle contracts, the bone moves in one direction. And when the muscle relaxes, the bone moves in the other direction. You may have seen some of these connective tissues, the tendons and the ligaments, if you eat like a piece of chicken, a chicken leg or something. You might have seen some of these pieces of chicken leg that are not the muscle and they're not the bone. They're usually white in color, and so those are the tendons or the ligaments. Ligaments connect from bone to bone, and the tendons connect muscle to bone. Connectors of the body. All right. Oh, so you have some more thing called cartilage. Cartilage is what makes up your nose. It's not a bone. It's rigid, but it's not a bone. Your ears have a shape, but there's no bone in there. That's just cartilage. And cartilage is between most of all of your bones, to kind of cushion that area, because you don't want your bones to be bone on bone. That would hurt. You want to have a little cushion in there. This is the way I remember the difference between tendon and ligament. A tendon has 5 letters, and so does the word muscle. So a tendon connects muscle to bone. Ligament has 8 letters, and that makes me think of bone to bone. Bone has 8 letters, and that helps me remember ligament is bone to bone, tendon is muscle to bone. If you break your bone, that's exactly what would happen. A fracture or a break is basically the same thing, and that which means you have broken your bone. Excuse me. Okay, it can happen anywhere. You just got to be careful. Problems of the human skeleton. Well, there's swelling is a problem. Arthritis is a problem. A sprain is a swelling of a joint. You might have heard of that or had that. And arthritis is when you have inflammation or swelling between your joints. Also, you could have a curved spine, but it's supposed to be straight. If you look from the back, it's supposed to be straight. And sometimes it might curve, and that's a problem you would have to go see the doctor about. That's called scoliosis. Osteoporosis is when you do not have enough calcium, and your bones become brittle. This is a normal bone, and this is the osteoporosis bone. You can see there's not much tissue there, and it would break easily. All right, some fun, amazing facts. Excuse me. Half of your bones in your body are in the hands and the feet. The longest bone in your body is your femur. It's about 18 and a half inches long when you're an adult. The smallest bone in your body is located in your ear. It's called your stirrup. You have 3 bones in your ear. Your face has 14 bones. You are using 12 facial muscles when you smile. Your leg is the fastest growing bone in your body. Sometimes you might feel it grow and it stretches and it hurts. That's a real pain. It's called a growing pain. That's when your bones are growing. Your bones have to grow too, just like you do. A giraffe has the same amount of bones in his neck as you have. His bones are just longer to make a longer neck. It takes more muscles to frown than to smile, so smiling is easier. Okay, think about posture. Posture is very important, and we're going to have a lesson on posture. So, when you are using good posture, you're sitting up straight and you're using good posture, your bones are aligned, your body is in the position it needs to be. We are on our tablet, on our phone, on our computer a lot. So when you do this, look at the bottom illustrations. So make sure you're sitting up straight and you get good blood flow to your brain and your spine is aligned so that you have good posture. And here are 3 good examples of how to have good posture. Bring your device up to you so you can see it. Don't bend your head down. That causes strain in the neck. Okay, and posture is good for kids. Look at this, good posture. Your ears and your shoulders and your hips and your knee and your ankle should all be in one nice line. Not a straight, stiff, rigid, like soldier line. It should be just a nice, relaxed, straight posture. This really will affect your health in a good way. Let's take care of our skeleton and take care of ourselves. Maintain good posture. How can you help take care of yourself? Eat healthy foods, get those calcium and vitamins and minerals to help those bones. Exercise does help strengthen your muscles, and your muscles help protect your bones. And get enough sleep. That also helps keep you healthy. Very good. The end of part 2 of our skeleton lesson.